Yeah, yes. Absolutely.
Muy buenos días y bienvenidos al
Good
webinar
morning
de la
and
Organización
welcome to
Panamericana de
the
la Salud
PAHO
para
webinar
conmemorar el Día Mundial
to
para la
commemorate the
Eliminación del Cáncer
World
Cervicuterino. Soy
Cervical
Silvana
Cancer
Luciani, del
Elimination
Programa de
Day. This is
Enfermedades No Transmisibles
Silvana
de la
Luciani
OMS
of the
y es un gran placer
NCDs
darles la
of
bienvenida a este webinar.
PAHO. It's a
Antes de
pleasure to
empezar, quiero
welcome you to the
avisarles que el
webinar. Before
webinar
we start, I would like to let you know
tenemos
that
traducción
we have
simultánea en inglés,
simultaneous
español y
interpretation
portugués.
into
Solo hay
English,
que
Spanish,
escoger
and
su idioma
Portuguese.
en el
You
botón
simply
de
have to choose your
interpretación
preferred language
abajo.
in the little
Good morning and
globe
welcome everybody to the
in the lower
American
part
Health
of your screen.
Organization's webinar to commemorate World Cervical Cancer Day, our first day for an elimination of a cancer. I'm Silvana Luciani from the NCD program at PAHO in Washington, D.C., and it gives me great pleasure to welcome you to this webinar. And before we begin, I just want to advise that the presentations are going to be in English, Spanish, and Portuguese, and you simply need to select your language choice using the interpretation button at the bottom. Estamos muy emocionados de tenerle en este webinar para llamar la atención sobre la posibilidad de
We're
eliminar por la
excited
primera vez un tipo de
to
cáncer muy
welcome
prevalente en
this
mujeres, ya
webinar
que
to
tenemos todos
analyze
los
the first
elementos para
possibility
prevenirlo
to
con la
eliminate
vacuna contra
cervical
el
cancer.
VIH,
We
las pruebas
have
de
elements for
VIH
that,
y las vacunas y las lesiones
HPV
precancerosas. Lo que
medicines
nos
and
motiva hoy día es
vaccines and
quedar uno de las
elimination of
primeras, ya que estamos
precancerous
en el
conditions. In the
camino hacia
Americas,
la
we are well
eliminación después de
underway to
tantos años
the
trabajando en la
elimination
prevención del cáncer
after many
cervicuterino.
years
Así que hoy
working on
día en
the
el webinar vamos a
prevention of
presentar en un
cervical
panel con
cancer.
distinguidos
Today, we
ministros de
will
salud
have
de la
this
entidad y con
distinguished panel
algunas
with
historias
health
de éxito
ministers from the
con la
region,
vacuna contra el
some
VIH,
success
el cáncer
stories
y el
on the
tratamiento. Y
screening,
también en un
treatment,
panel
and
con
vaccine
nuestros socios claves en
for
la ONU,
HPV,
quienes están
and a panel
brindando
with
estas
key partners
organizaciones
with support
internacionales.
from
Así que
international
bueno, muy
organizations. So
interesante.
we have a
Y
very
para
exciting
darnos las
program
palabras de bienvenido, es un
for
honor
the
darles la
welcoming
palabra
words.
al
It's
doctor
an honor to
Jarvis
give the
Barbosa,
floor
el
to
director
Dr.
de la OPS
Jarvis
en Washington.
Barbosa,
Doctor
Director
Barbosa.
of PAHO here in Washington, D.C.
Thank you, Silvana. Good
Dr.
morning,
Barbosa.
everybody. Dr. Alexandre Padilha, my good friend Padilha, Minister of Health of Brazil. Dr. Carlos Alvarenga, Vice Minister of Health of El Salvador. Dr. Moin Joseph, Minister of Health, Wellness and the Environment of Antigua and Barbuda. Felipe Donatude from the UNITAID. Also Oriana Ramirez from ICID. Pedro Barbosa from IBPMP. Colleagues from international organizations, members of civil society, participants from the region of the Americas. It is an honor to welcome you to this webinar commemorating the first official World Cervical Cancer Elimination Day. Today, we reaffirm our shared commitment to a future where cervical cancer no longer threatens the lives and well-being of women across the Americas and around the world. Cervical cancer is preventable and curable, yet it remains one of the leading causes of cancer deaths among women. Over 78,000 women were diagnosed with cervical cancer in the region of the Americas last year, and nearly 40,000 lost their lives to this disease. These figures remind us of the urgent need for concerted action. The World Health Organization Global Strategy to Accelerate the Elimination of Cervical Cancer sets ambitious but achievable goals for 2030. Vaccinating 90% of girls against the human papillomavirus before the age of 15. Screen 70% of women with high-precision tests at ages 35 and 45. Treat 90% of women with precancerous lesions or invasive cancer. The Pan American Health Organization, PAHO, has a long history of working with our member states to prevent cervical cancer, including through the Plan of Action for Cervical Cancer Prevention and Control 2018-2030, which contemplates the complements the WHO Global Strategy. In the Americas, we have made significant progress. 49 of the 51 countries and territories have introduced the HPV vaccine into their national immunization programs, with first dose coverage reaching 70% of eligible girls. HPV testing has also been introduced in several countries. Though expanding coverage and ensuring proper follow-up remain critical to achieving elimination targets. To maintain and accelerate these advances, it is essential to ensure equitable access to the tools needed for prevention, detection, and treatment. Currently, PAHO member states can procure HPV vaccines, HPV screening tests, colposcopies, and treatment equipment through our regional revolving funds. Let me now switch to Spanish. En el Día Mundial de la Eliminación del Cáncer Cervical.
Today, in the World Cervical Cancer Elimination Day, we have the opportunity to mobilize innovation, share knowledge, and join efforts. We will hear today how the molecular biology sector in Paraná, IBMP in Brazil, has launched the first HPV test valid in Brazil and Latin America for the screening of cervical cancer. In this day, we also have the valuable presence of partners such as ICID and UNITAID, whose commitment and support have been essential to move towards that common goal. At PAHO, we are committed to support countries in the road toward the elimination of cervical cancer, investing in training in health professionals and actions in screening and vaccination programs. I invite you to reflect on the role of each of you in this movement and to be policy deciders, activists, researchers. All of your contributions are essential. Thank you for being part of this effort and for your collaboration and your commitment, your firm commitment to health and dignity of our women and girls. This day, 17 November, will be remembered every day as a sign of hope, solidarity, and action. Let's continue together building a future where the future generations live free from cervical cancer. Thank you very much again for your participation at your webinar. Thanks to the ministers and partners who will share with us their success histories, and welcome everybody to celebrate this World Day to monitor the progress to make, because the Americas can and has to be the first region in the world in eliminating cervical cancer. Thank you very much. Thank you very much to you, Dr. Jarbas Barbosa, Director of PAHO. And we all agree that, yes, the region of the Americas can be the first region in the world to eliminate cervical cancer. Thank you very much for being such a valuable champion in our struggle to eliminate cervical cancer. Now we move to the panel with the Ministers of Health who are here with us. It's an honor to have here Minister Alexander Padilla from Brazil, Joseph from Antigua and Barbuda, Alabi from El Salvador, and Ximena Aguilera from Chile. Welcome, everybody. We will start with Brazil, with Dr. Padilla, Minister of Health of Brazil, who will present the experience in Brazil.
Honorable Ministers of Health of the Americas, Honorable Dr. Jarbas Barbosa, my friend, dear colleagues, partners of the Pan American Health Organization, researchers, friends. It is a source of great joy to be a part of this panel and celebrate with you the World Day for eliminating cervical cancer. We have a long history of partnership with PAHO and WHO, decades of technical cooperation. For example, we built one of the largest public immunization programs in the world together, created in 1973, as well as initiatives to eliminate uh, chickenpox, rubella, and the vaccination week in the Americas. It is important to have capacity in Brazil to eliminate cervical cancer. It is a commitment with public health, but also for social justice and equity. Cervical cancer expresses inequities in terms of social class, race, and it is focused mainly where prevention and diagnosis are lacking. In Brazil, mainly women aged 25 to 64 are the victims, those who depend the most on our unified health system, SUS, our public universal healthcare system, and live in areas where access to prevention is more difficult. Ladies and gentlemen, no women should have a preventable disease. Our strategy is integral. It is integrated. It has three pillars: vaccination, organized follow up, and treatment. We have three essential dimensions in the first pillar: trust, communication based on evidence, listening actively to the families, community engagement to prevent vaccine hesitation, which is fostered by negating vaccines' effectiveness and disinformation. Convenience as well, access at schools and broad hours of availability. And we have clear targets and information systems that allow for people to have the access to full vaccination schemes. In 2014, Brazil introduced the HPV vaccine in our national immunization program. I was Minister of Health at the time. And in 2017, we expanded it to boys as well, now promoting gender equity in health. Since April 2024, we started to use a single dose for 9 to 14-year-old boys and girls, following WHO and PAHO guidelines. Today, our coverage is above 82% for girls and around 67% for boys between the ages of 9 and 14. In addition, in 2025, we expanded temporarily the age range to 19 years of age in order to cover those teenagers who did not have access to the vaccine during the COVID-19 pandemic. Brazil continues to use the uh, quadrivalent vaccine covering genotype 16, 18, as well as two others, the main causes of cervical cancer. We are confident that Brazil will reach the 90, 70, 90 targets of the WHO by 2030. 90% vaccine coverage, 70% screening, and 90% appropriate treatments. That was the set of targets corroborated and launched by our president. Honorable colleagues, dear Dr. Barbosa, through the program Health at School, the Ministry of Health and Education work together through a network of state secretaries of health taking vaccines to where we can find teenagers. We have an active search of appropriate aged children and teenagers to be vaccinated. We also reach out to indigenous areas with the full support of local leaderships. Ladies and gentlemen, we know that vaccine hesitancy is a global challenge, and therefore Brazil focuses on social actions to overcome fake news and return to evidence based decisions and actions. That is why organized screening, information campaigns, capacity building, and dialogue with families and the communities are so important. Brazil has becoming more modern by using a molecular DNA HPV test as its main test, replacing traditional cytopathological exams. I would like to congratulate PAHO in their support, and also because without that support we could not have developed this very modern test. Today we have a 100% national technology with high level of implementation, and we are at your disposal to broaden access to this technology by other countries in the Americas. This new screening model started in 12 states of our country as an initial stage, and we will expand it to the entire country by 2026. Women can have access now to the screening test in primary care. They collect material themselves, and the entire process is monitored, so we continue to care for that woman. Friends, in the second pillar, timely treatment. Right now, our president, Lula, launched the program. Now we have specialists with actions to ensure that a woman who needs biopsies, colposcopy, or treatment for cervical cancer has access to it in a timely manner. Now we have specialists integrates with specialized primary care. It follows clinical protocols. We use teleappointments, telemedicine, and access to biopsy reports electronically with the support of properly equipped hospitals in a coordinated network, so we don't have a very long wait time both for diagnosis and treatment. The program allows for a continuous process. It is a great effort to bring that system to the entire country. We will reduce mortality and fight inequity through this program. And for that, we are expanding the use of radiotherapy as well as brachytherapy and colposcopy, the largest expansion in the history of our health system. I would like to highlight the indicator C7, which is treating women in preventing cervical cancer as a primary health care strategy. We try to analyze women's needs and focusing on preventing cervical cancer as part of sexual and reproductive health. We coordinate actions with local governments as part of the new strategy for financing primary care in health as part of Health Brazil 360. And finally, we want to integrate vaccination, DNA HPV screening, and timely treatment using primary care as a conduit. The specialist program is now helping us further in taking care of any deficits we used to have in specialized care. Each vaccination dose, each test, each treatment combined are emblematic in our efforts against this disease and for women's dignity. Our COP30 conference, which just closed with a day for health in which our friend Jarbas Barbosa was present, we talked about how to adapt our health systems in order to protect the most vulnerable populations in facing climate change. That has to be a permanent commitment by all of us. Our strategy to protect women and treat cervical cancer is reaching precisely women who live in territories most affected by climate change. Climate tragedies, especially those that represent large climate crisis, destroy healthcare centers. And when that happens, the entire diagnosis and treatment, early treatment chains are broken related to cervical cancer. And for that reason, the Brazilian government is now in its in its guidelines for building healthcare centers, primary healthcare center, we are following positive experiences, good experiences and practices disseminated by PAHO. Fighting the climate crisis is another important step in order to protect the women who live in our region.
Many thanks, Dr. Alexandre Padilla, Minister of Health of Brazil, for sharing your time, your perspectives, and for the outstanding commitment to eliminate cervical cancer in Brazil. Really, your leadership has been extraordinary in the significant investments and the changes in the Brazil healthcare system, strengthening primary care, expanding access, prioritizing vulnerable populations, and improving the treatment and specialist care has been really a stellar example for the entire region. Thank you. Thank you very much, Dr. Padilla, for sharing your time with us.
Thank you.
Thank you. So we move now to Antigua and Barbuda, a country that has introduced HPV testing in their national screening program. And we'll hear from the Honorable Dr. Malwyn Joseph, Minister of Health, who will talk about the experience of HPV test introduction, cervical cancer elimination in Antigua and Barbuda.
Well, thank you very much, Madam Moderator. Let me begin by recognizing Dr. Jarbas Barbosa, Director of the Pan American Health Organization, other ministerial colleagues from Brazil, El Salvador, and Chile, and the wider Pan American Organization territory, distinguished speakers from other partnering organizations, Dr. Alison Hennis, Director of Non-Communicable Diseases and Mental Health PAHO, Dr. Mauricio Maza, Regional Advisor for Cancer Prevention and Control, other guests. I bring you warm greetings from the Twin Island state of Antigua and Barbuda. It is an honor for me to share in this momentous occasion with all gathered here. Today, as we commemorate the launch of World Cervical Cancer Elimination Day, Antigua and Barbuda stands united with the global community on the WHO's historic call, the first time in history that the world has committed to eliminating a cancer. For the next few minutes, I want to share with you how the government of Antigua and Barbuda is moving from awareness to action through our National Cervical Cancer Elimination Program. From the period of 2014 to 2018, cervical cancer was identified as the third leading cause of death from cancer in women in Antigua and Barbuda. As is commonly known, cervical cancer is largely treatable with early diagnosis and effective treatment. We recognize that low screening rates and low diagnosis stood as the most significant challenges. Many women opted not to be screened regularly, often due to fear and lack of awareness. As a result, by the time symptoms appear, the disease is likely to be advanced in stage and more challenging to treat, requiring chemotherapy and radiation. Therefore, the government of Antigua and Barbuda made a staunch decision to safeguard women's health in the hopes of significantly reducing preventable deaths in the years to come. We began our journey when, with the help of PAHO and WHO and Basic Health International, we embarked on a task to reach the 90-70-90 goals to accelerate the elimination of cervical cancer in 2030. To accomplish this, we set the stage with a needs assessment to determine the country's readiness to implement a 1,500 pilot program for high-quality cervical cancer screening with the HPV testing. This screening was successfully conducted in 5 of the country's primary healthcare clinics. Over the past few years, we have faced and overcome significant challenges, including low screening coverage, delays in diagnostic services, and long-standing gaps in data management. The government responded decisively by restructuring the cervical cancer screening services in primary care, removing the financial barriers from the provision of free HPV testing in all public primary care clinics and waiving all fees for colposcopy and cervical cancer related care. Colposcopy capacity was expanded. Referral pathways were strengthened, and electronic health record systems were utilized to improve the quality, timeliness, and accessibility of care. A dedicated gynecological oncology service was also established to care for our women diagnosed with cervical cancer. These investments reflect our unwavering commitment to achieving the WHO cervical cancer elimination targets. Now, in this year's phase of scale up for all primary healthcare clinics, we followed a patient pathway that consists of HPV screening, cytology, colposcopy, and treatment as necessary. Of those treated, we ensure that there is adequate follow-up. Between February and October 2024, 2,076 women were screened, of which nearly 20% were positive for HPV genotypes associated with high risk of cervical cancer. Ensuring that these women receive the follow-up services that they require represents a huge challenge, and it is something that our health professionals are constantly working to improve. As of June 2025, approximately 3/4 of these women have received treatment, and we will keep working to ensure that women get the treatment that they need and towards reaching the 90% treatment target of the elimination strategy. Screening and early detection services indeed save lives, but only if women have access to it and feel empowered to use it. As Minister of Health and Wellness, I also want to underscore the role and responsibility of the government in this strategy. The government of Antigua and Barbuda has a moral and constitutional duty to protect the health of its citizens. That means that every woman can access quality, affordable, and timely screening services and treatment. This also means that we must have the requisite policies, infrastructure, and trained professionals in place to integrate screening services as part of the routine healthcare rather than an optional extra service. When a woman dies from a preventable disease like cervical cancer, it is not just a medical failure, it is a societal failure. For our population of approximately 100,000 Antigua and Barbuda, each one of those deaths has a significant effect in the community. This is why the ministry has made cervical cancer a national priority. Our ministry is dedicated to increasing public education and awareness through government-led campaigns. We are also committed to ensuring clinics have the equipment, supplies, and trained personnel needed throughout the patient care pathway. In conclusion, it is our vision that Antigua and Barbuda becomes a country where no woman dies from cervical cancer, and where every young girl is protected from HPV through HPV vaccination. With 2026 on our heels, we have approximately 4 more years to reach the 90, 70, 90 targets to accelerate the elimination target. Today, I reaffirm the commitment of the government of Antigua and Barbuda to seeing this vision actualized. We continue to work tirelessly, and I am immensely grateful to partners such as PAHO, WHO, and Basic Health International. Together, we can make cervical cancer a disease of the past in Antigua and Barbuda and throughout the world. Let us continue to strive together to give every woman the opportunity to live a life that is long, fruitful, healthy, and hopeful. Thank you.
Excellent. And thank you very much, Dr. Mulwin Joseph, Minister of Health and Wellness of Antigua and Barbuda, for your outstanding leadership, making cervical cancer elimination a national priority and for showing us how, with conviction, coordination, partnerships, you can change screening paradigms, reduce healthcare barriers, and increase coverage for HPV vaccination, HPV testing, and treatment. You've been a real true inspiration for many of us, and especially in the Caribbean, where we're now seeing neighboring countries adopt a very similar approach to what has been implemented in Antigua and Barbuda. So thank you again, Dr. Joseph.
And thank you.
Thank you. Ahora seguimos en el programa y pasamos a Chile, a la doctora Jimena Aguilera.
We now go on to Chile. We're going to hear from Dr. Jimena Aguilera. She is the Minister of Health in Chile, and she is going to be talking about the path in Chile toward the elimination of cervical cancer. So it is a pleasure to see you, Dr. Aguilera. Good morning. First of all, I wanted to affectionately greet Dr. Jarbas Barbosa, who is Director of the Pan American Health Organization, and also I greet the Minister of Health of Brazil, El Salvador, and Antigua and Barbuda. And of course, also I greet Dr. Silvana Luciani and the whole team of the Pan American Health Organization that supports this initiative. I just heard that there was a problem with the audio. No, we can hear you just fine. So I do have a presentation, if you would allow me to share it. I'll put it on the screen.
¿Se ve bien?
Sí.
Can you see it? Yes. I was saying that it was an honor to be invited to this webinar. Today we are celebrating Cervical Cancer Elimination Day, and we in Chile are fully committed to eliminating this disease. We began down this path some 60 years ago with the support of the Pan American Health Organization, including screening and pap testing, and also training teams to use this technique. In 1987, we created a research program to control cervical cancer, and then we included cervical cancer in the system of explicit guarantees in the health system. And in that way, all women in our country are legally guaranteed access to screening, diagnosis, treatment, and follow-up, including palliative care, always with an eye on protection and financial soundness. In 2014, we began the vaccination strategy with the tetravalent vaccine for girls, and in 2019 that was expanded to include adolescents and boys. And then last year, in 2024, we incorporated the non-valent vaccine. So in that way, we cover more types of virus. That same year, we began the co-test. We combined the pap test and the molecular test for human papillomavirus. All of this following up on modernizing our screening. In 2020, the National Law on Cancer was passed, and I will get into that later on. And during our administration, we have supported the global efforts to eliminate this disease. Also, we are regulating the basket of healthcare services, and this is being done in both the public and the private sector. Each of these milestones show the continuity of the public health strategy in Brazil, and all of this has saved lives and moved it closer to eliminating cervical cancer as a goal of public health. So the National Cancer Law, as I said, was passed in 2020, and there it became part of our national policy. It established a permanent legal framework for prevention, diagnosis, and treatment of different types of cancer, and the law set up the National Cancer Fund. It also established a cancer registry, and it promotes coordination of action between the state, academia, and civil society to assure an evidence-based strategy. In the case of cervical cancer, we are emphasizing research, treatment. The idea is that this be a permanent commitment, an ongoing commitment to the health of women in Chile. Allow me to share with you some details having to do with the elimination of this type of cancer. Vaccination, early detection, and timely treatment. Regarding vaccination, through the National Immunization Program that was eliminated as of 2014, vaccination against HPV in girls was later expanded to include coverage for boys, and also using the 9-valent vaccine. So the National Immunization Campaign is free, and all the school population has access in both public and private schools, and also through the vaccination program. This year, the coverage in girls under 15 was 86.2%. To reach the 90% goal this year, we implemented a national strategy where we are working with adolescents not in school, and that includes women up to the age of 21. Pillar 2 is early detection. Since the time when the cancer control program was set up in 2017, we have guaranteed access to Pap testing for women between the ages of 25 and 64, and that has allowed us to control mortality due to this cause. So to include this in 2019, all women were assured access to care, and also this includes screening, diagnosis, and treatment. The explicit guarantee system created in the health reform provides a legal guarantee to receive care for diseases. The idea is to provide financial protection as well as medical care for both public and private systems. And in the public sector, these services have no cost thanks to the copay system that has been implemented. It is important to look at the beneficiaries of public insurance, and that covers 70% of the population. In the case of the private sector, the total could not be greater than 20%, and there is a maximum copay ceiling. Now, Chile has had a Pap screening system in place going back to 2023. If we look at the data from the public health sector, it is at a level of 63%. This coverage, although it is significant, shows variability across different regions of the country, with better results in urban areas and with challenges still pending in rural communities. Also, we use the molecular detection for HPV in different healthcare services, and in 2026, as I already said, that test is part of the basket covered by healthcare services, giving universal access to this technology.
Since 2024, we are piloting self-help to detection of HPV. This program has a high acceptance by women, more than 88%. We thus expand the coverage of screening, especially for women that face sociocultural work or societal barriers to access these services. As to the third pillar, timely treatment, as I said, this is guaranteed by the physical guarantee that has times and quality levels for each stage of the treatment, that the results of screening tests have to be notified within 30 days of conducted, and the diagnosis has to occur within 40 days of the suspicion of cervical cancer. And then treatment varies according to the situation, 180 days maximum for low-degree lesions and 30 days maximum for invasive lesions and 20 days maximum for invasive cancers. And this is follow monitoring as first controlled after the medical declaration. Meeting these guarantees in these time periods I mentioned has been close to 99% since 2005. We have more than 9.6 million women have used this guarantee with timely treatment and diagnosis in the country. As to the invasive cervical cancer, we have a whole array of services: radiotherapy, brachytherapy, chemoradiotherapy, and increasingly therapies, directed therapies and immunotherapy. We are collaborating with the industry. Palliative care that I mentioned before are an essential part of Chile's response to cervical cancer. This right is also guaranteed through the explicit guarantees strengthened by a special law, Law 21375 of 2023, that ensures that all cancer patients have timely treatment for pain, decision-making, and support. This guarantee also allows women to face the disease with greater peace of mind and dignity, regardless of their socioeconomical situation. What has been the impact of this strategy? Thanks to the consistent policies from Chile for over 5 decades, we have specific, concrete results in the fight against cervical cancer, from the creation of the National Research and Control Cervical Cancer Program in 1987, and then the extension to health guarantees. Our country has made great strides, achieving a 56% reduction in this cancer. We are closer to the elimination target proposed by the WHO. The incidence also has been in a downward trend, starting from 11 cases by 1,000 women in 1997 to 4.6 in 2024. This has been a great progress in this downward trend. So the burden of disease attributable to cervical cancer has been consistently reduced, with an increase in the years, disability adjusted life years. So legal guarantees support universal and free of charge vaccination that has prevented many deaths and has reduced the burden of disease with a solidary and effective policy with equity. We have a phased reduction, first with the oncological screening, then treatment guarantees, and then the stabilization from 2014. This means that we have reached the limits of psychological screening. As to the non-valent vaccination implementation and the timely treatment, projections indicate that Chile could reduce significantly the incidence by 2055, an 82% reduction. To conclude, I want to reaffirm that Chile moves firmly toward the elimination of cancer as a public health problem, with all the work of previous ministers, equity that affects women and poorer women, and also what the minister from Antigua and Barbuda mentioned, that this is the first cancer we want to eliminate. We have had for 6 decades a comprehensive strategy fully in line with the 3 pillars of the WHO and PAHO global strategy. Thanks to these consistent policies, we have been able to reduce mortality by more than 50%, with a consistent reduction in incidence and burden of disease. The government also is based on multilateralism, and we value our joint work with partners and PAHO. The elimination of cervical cancer is an act of justice, equity, and the right of all women to have a timely and quality treatment. And it's also a demonstration that through treatment, screening, and vaccination, we can ensure that no woman dies from a preventable disease. Thank you, Minister from Chile, for this incredible advance. In Chile, a country of large history, in incredible advance toward the 90-70-90 target with explicit guarantees of health, and we see the great impact that you're having in Chile with the reduction in mortality. Thank you very much. Now we move to El Salvador, one of the pioneering countries in the region with the introduction of the HPV vaccination. Dr. Alvarenga will present El Salvador's experience. Good morning. Thanks, Dr. Barbosa and all PAHO colleagues, Sara Benitez and others. A very special greeting to the colleagues and ministers, the presenters, and for the achievements in each of your countries. Cervical cancer is very important. The Chilean minister said that we can achieve the elimination of cervical cancer. In El Salvador, it's an honor to implement the strategy for the acceleration of the cervical cancer elimination. This is a big goal. We will have a presentation about the implementation of the accelerated strategy to eliminate cervical cancer in El Salvador. This is a snapshot of NCDs. The total deaths in El Salvador, 71% are for NCDs, 54.7% for prioritized NCDs, and 37.7% NCDs are premature. You see that cancer is the second cause of deaths after cardiovascular diseases in our country. This is a snapshot of cancer in El Salvador. We have prioritized different types of cancer. At the left, incidence, and at the right, premature mortality by 2024. We have a 17.4% incident of cervical cancer, and the premature mortality for cervical cancer is 6.4%. This is our model to implement the elimination of cancer overall. We have a systemic approach in the second column, improve institutional capacities, and the third column is that of results. You see that all our diagnosis is based in the status of cancer in El Salvador, based on our indicators, but also we assess the risk factors for cancer. What have we done in strengthening institutional capacities? We have strengthened the legal and regulatory framework with a national law against cancer, national policy for cancer prevention. We strengthened human resources, doctors, specialists, nurses. We have health promoters all over our country and also lab staff. We also have strengthened the installed capacity of infrastructure and equipment and vaccinations, and also we have research, transformation of impacts and priority lines. I always say that human resources are basic, but the digital transformation is also a great factor to improve the quality of care services, also the development of information system. What process have we conducted to address cancer? From health promotion, disease prevention, early diagnosis and screening, timely treatment and rehabilitation and palliative care. And we also have a cancer registry at hospitals. We also have a population-based cancer registry, etc. But this has to be addressed holistically, and this is the intersectoral approach. There has to be an intersectoral approach in primary care, and we need partnerships and strategies to address cancer. The greater the screening, the more results we obtain. Here we show the cases of cervical cancer, but also the cases between people of 30 and 59 years of age, and what percentage. What do we see here? That with the tests we are conducting, we are finding more cervical cancer. The 90-70-90 strategy is here showing what PAHO and WHO have established. But there's vaccination for both sexes. Women screened from 30 to 59 years of age with the VP8 HPV test, and in 2020 our Ministry of Health adhered the strategy. This is a time chart of our milestones. In 2012 to 2017, we had a demonstration project. In 2019, we started a first phase with HPV screening and test and treatment for health regions, 2 health regions right now. In 2020, we started a second phase with HPV screening, but also in 2 additional health regions, and we also incorporated the HPV vaccination into the national vaccination scheme. So here we implemented the 2 doses in the second phase in 2020, where we joined the 90-70-90 strategy of PAHO. In 2021, we had support project, and for the third phase, we started the HPV test at national scales. The implementation of this screening test is at the national level in all health facilities and hospitals. In 2022, we also incorporated the self-sampling, and 2022 we also have treatment with thermocoagulation, updating technical guidelines and also other measures. For 2023, we started in national hospitals this initiative, and we incorporated the HPV vaccination in boys and young children. We have a coverage of 84% of 1 doses of HPV vaccination. We have screened 73% of women with the HPV test and found a 15% positivity, and the vaccination scheme is modified to 1 dose. This is the installed capacity for screening. This is in our country. This is a comprehensive map of El Salvador. We have these facilities in all health regions in our country. This is important to indicate that this is a national scale initiative to prevent that the disease reaches hospitals. We have 75 first-level treatment centers, 5 facilities in national hospitals. This is the distribution of diagnosis, treatment, and screening in the country. This is the network for care for screening and management at the attention levels. This is our current situation, but we would like to reduce this gradually. We want to prevent any complications in reaching our goal. The first level of care, we have promoted the sampling and labs that process these samples, then move samples to a center for a visual assessment, and then a thermocoagulation treatment, and if necessary, a second level. At that second level, there would be a follow-up, and if this is problematic, we will move to a third level with oncological treatment, chemotherapy, radiotherapy, surgery. In this case, we would send our patients to this National Women's Hospital. So we have 3 levels of attention. We have a National Radiotherapy Center with complementary assessment if necessary. And we're also working in the process of palliative care in all health facilities. And soon we will start building a National Palliative Care Center. What have we also done? In addition to training, we have developed clinical paths. At the left, you see an image of the clinical road for screening and early prevention of cancer. This is a very interesting strategy because we have summarized very visually the process, and this is a very attractive material that trains health staff and helps us to standardize the variability in the management of clinical treatments. We have trained doctors, generalists, doctors, specialists, nurses, health promoters in communities, and also all the other human resources. The training has been theoretical but also practical, as seen on the left, and many of the technical guidelines for the prevention and control of breast and cervical cancer is very important, with different elements such as the institutionalization of screening, and with guidelines for the clinical lines training, the definition of the network of care, 80% resolutive, but we also have thermocoagulation and annual goals for screening and treatment and follow-up of the patient. What achievements have we had? El Salvador is the only country in the region that has innovated and institutionalized at the national scale the screening of HPV test in two modalities, sampling in health services, but also self-sampling.
Also, we treat patients based on the results of HPV testing. Some other highlights include the inclusion in our vaccination system vaccines against HPV. That began in November of 2020, and a single dose is given to both boys and girls, to boys between 9 and 11, and for girls between the ages of 9 and 21. Next year, we'll extend that age to 30. Now, PAHO has definitely been a very strong ally working in this area. The goals that we have for girls, we have reached 84% of girls vaccinated. We're very close to our goal. And in the case of boys, 63% of them have been vaccinated. And in the case of screening between the ages of 30 and 59, we have screened 73%. So we are at the goal. And in terms of treating women with a positive HPV, we are at 76%. So close to the goal, but not there yet. Now, here we have decreased the premature mortality rate from 11.12 per 100,000 to 6.4, which was the figure for last year, for 2024. Now, what are we trying to do? What is our challenge? We want to become one of the first countries, if not the first country, to eliminate cervical cancer as a public health problem. And this was said by the Minister of Health for Chile. It's a matter having to do with dignity of women. So that is something we can achieve. It's something preventable, something we can do. And our dealing with chronic diseases, cancer, we follow 4 modalities. We do health promotion, disease prevention, early identification, early diagnosis. So if we can do those 4 things, we can say mission accomplished. And with that, I thank you. Thank you. Thank you very much, Dr. Alvarenga, Minister of Health of El Salvador. Thank you for showing us your commitment to simplify resources for screening, for treatment, at the primary care level. I like the way that you are providing guidelines for this whole process, looking at the public health system, but also by strengthening your laboratories, and you're already getting a decrease in mortality. So thank you very much. Thank you, and I congratulate you for
the panel from the ministers
your
of health
accomplishments.
From the region, and I wish to thank all of our esteemed ministers from Brazil, Antigua and Barbuda, Chile, El Salvador, for showing us that leadership, commitment, health system changes, and investments can really make progress towards the 90-70-90 elimination targets. And this really has been an inspiration for all of us today on this World Day. I also want to recognize that there are many other countries in the Americas region. We really are the first region in the world that can potentially eliminate cervical cancer, making significant progress. Unfortunately, we didn't have enough time to showcase all the other countries in our region, but at PAHO, we're working hard to monitor progress towards the 90-70-90 targets for all the countries in the region. And we've created a dashboard, which is a visual presentation of the progress towards elimination. So we would like to encourage you all to visit the PAHO webpage on cervical cancer and to visit our dashboard and see this progress and to join us all in this great commitment that we have to eliminate cervical cancer. We'll put the link in the chat so you can learn more about it. So let us continue on with the program, and we're going to move now to our next panel of partner organizations, and I'm going to pass the moderation of this panel to my colleague, Dr. Mauricio Maza, the PAHO Regional Advisor for Cervical Cancer Prevention and Control, to kick us off. Mauricio, over to you.
Thank you. Thank you, Silvana. And I want to highlight what you said. We had a lot of people from around the world in our chat exchanging their experiences from all over the world. So highlighting that this is a global challenge that demands unity and innovation. And this wouldn't be possible without our key collaborators. So I'm switching back to Spanish. Y primero, deseara hacer una presentación para la doctora.
First of all, we're going to hear from Dr. Oriana Ramirez Rubio. She is the health chief of the Spanish Agency for International Cooperation for Development. AECID. So the first forum to eliminate cervical cancer was carried out in Colombia, and that furthered the commitment to this cause, working with many different organizations. And since then, there has been support given to the regional efforts to eliminate cervical cancer. So thank you very much, Doctor, for being with us today. Thank you. And good morning, good afternoon. A special greeting to Director Jarbas Barbosa, to the Ministers of Health that were part of the previous panel. All of this was very inspiring, and I congratulate everyone as well as the PAHO team. I congratulate Dr. Hines, Dr. Massa, and also we see that we have 819 participants. So a warm greeting to all of them from the Spanish Agency for International Cooperation for Development. So we're happy to be part of this event to celebrate with PAHO. PAHO is our strategic partner for Spanish cooperation in the health sector in the Latin American and Caribbean region. It's tremendously important to celebrate and it's not Cervical Cancer Day, no, it is the day where we celebrate elimination of cervical cancer. So for Spain, it is a great pleasure to see our domestic work dovetail with the international work done. Now, Spain has been championing this issue because it is crucial for us. It's based on two basic strategies. One is our feminist strategy, and that speaks to the political commitment to move ahead with implementing the 2030 agenda and also providing access to sexual and reproductive health. We consider this to be part of that strategy. And the other is global health. The strategy approved in May of this year, in 2025, in Geneva by the World Health Assembly. And there, the strategic guidelines call for working with the Spanish government, including our health ministry, our foreign affairs ministry, all of our cooperation efforts, a call for us to all work together. And the second part has to do with promoting health and living conditions to provide a control for disease, all of this with a focus on equity, especially for those populations that are poor or vulnerable. That takes as a point of reference respect for human rights and also holding up the rights of culturally sensitive populations. As Mauricio said, ICED was one organization that participated in the first World Forum for the Elimination of Cervical Cancer. It was called Advancing with a Call for Action, and that came out of a meeting that was held in Cartagena, Colombia. We worked with the government of Colombia, with the Bill and Melinda Gates Foundation, with PAHO, of course, with UNDAVI, UNAID, UNICEF, the World Bank, and USAID. At that event, Spain, through the European Union, through our foreign ministry, we announced a contribution of 10 million euros over the next years to deal with this problem as a problem of public health. And as I already said, with that agreement, with the feminist program. Now, in 2025, we were also a co-organizer for a meeting held in Bali, in Indonesia. And that commitment was made by our minister, working with different partners, with WHO, for example. We're working at the regional level and also taking specific action in some priority countries, Ethiopia, Morocco. But it is with PAHO, where we have a multi-year, 3-year line, where we are supporting the work done by PAHO, working with the countries of the region, providing training, both online and in person. Training that has to do with elimination, the 3 pillars of the strategy, and also supporting education, training products for the community and for the general public, teaching how important it is to participate in vaccination, screening, and treatment, the different phases to control the disease. Plus, we have bilateral action. For example, we have a call for innovation going back to 2023, where we financed a project to work with a program in Guatemala, working with their health authorities for early detection in rural areas, and especially innovative actions having to do with being able to do testing, screening, and treat all at the same time with the proper equipment, and also gradually creating ways to use AI to help detection. So, in short, the 17th of November begins the countdown, and ICED is grateful for your invitation to work with different organizations, working with survivors organizations. All of this is a global effort to eliminate cervical cancer. It has been interesting to look at the gains under the 3 pillars, and altogether we have to remind the world that we can all contribute to eliminating cervical cancer, and we wish the region every success. Definitely, you are moving in the right direction. Warm greetings from Madrid, and once again, thank you for the invitation. Thank you for that presentation, and thank you for all of your support. As you said, it's thanks to ICED that we as an organization are able to strengthen capacities and to promote more technical cooperation throughout the region. So thank you very much for joining us today for this celebration.
Very honored to welcome Dr. Philippe Duneton, Executive Director of UNITAID. UNITAID has played a pivotal role in advancing innovative solutions and forging partnerships that expand access to life-saving technologies in the fight against different diseases worldwide. So when UNITAID embraced the challenge of cervical cancer, we knew that transformative progress was on the horizon. We're really looking forward to hear from UNITAID and continue our collaboration as a region.
Thank you, Mauricio. And thanks, Dr. Barbosa, the director of PAO, for the invitation. And thanks, all of you. I see a very active chat, and it seems that we are more than 800 today, which means something. And I'm very pleased and honored to have listened to the Minister of Brazil, Minister of Chile, El Salvador, and Antigua and Barbuda, which illustrate the thing that we all know, that elimination of cervical cancer is feasible. It's a strong commitment to see all of you around this meeting. And I just want to highlight a couple of things. And in particular that, of course, if we want to succeed, we need the will and the leadership. And I think I can say that in PAHO today, you show us a very strong commitment and leadership. And I do agree with the one who made the point that, yes, it's feasible. And the progress that have been shown in Brazil, in Chile, in El Salvador, and Antigua, shown, and I know there are many other examples, but show the progress. And I think it's really encouraging. But as you just mentioned, Mauricio, I think that we need the will, we need the leadership, but we need also access and affordable innovation. And I think, obviously, in the case of cervical cancer, it's a very clear case that with innovation and technology, we can save a lot of women. Of course, we all know that investing in women's health, and thanks for the 3 board members who are sitting with us. I mentioned Brazil, Chile, and Spain. We had the support of the board to really try to address the call for action from WHO, but also the clear priority that is set by PAHO. And I think that it's encouraging to see a whole region to put as a priority in public health this elimination, the first possible elimination of cancer. So, of course, leadership and commitment, we see the progress. We see that there are countries like El Salvador, just before me, who have shown all the steps, and of course, a clear, not only commitment, but plan. Coming back to the innovation, we all know, and the Minister Padilla mentioned the importance, of course, of the coverage in terms of vaccine. So I think there are two legs in fighting cervical cancer. One is obviously the vaccination, and the good news is that it can also work for not only the teens, but also for younger women. So this, I think, is a key element to have in mind. But of course, we will miss part of the women that will develop cervical cancer. That's why we need to have a specific program to screen and treat women to eliminate cervical cancer. Of course, innovation exists. I can also make the point that there are innovation within Americas, in particular in Brazil. I think that there is a lot of lesson that was learned during the pandemic response in terms of tests that can be turned into screening cervical cancer. And of course, we have a strong collaboration with PAHO, in particular through the Strategic Revolving Fund that makes available the innovation at affordable price for several drugs, but also for cervical cancer, like the treatment in terms of thermoablation that is now very key to treat the women that have been tested positive. I want to highlight also, and based on our experience, the quality and the need to engage with the communities of women, not only for the vaccination hesitation, but also in accessing to test and treat. And there is something that we discover. It's something that works also in other diseases, but it's a self-collection. And this tool to allow the woman to take at home, in particular, and do the self-collection can, in certain circumstances, really increase the access for women to the test and, of course, for the treatment in case of positivity. So I think there is a huge potential in the Americas to be the leader. We are pleased, by the way, to support also other countries that will reach elimination in the coming years. In 3 years, countries like Rwanda are on track, and I think it will be, of course, something important to see the progress. And I think that this leadership in America, in particular in Latin America and in the Caribbean, will drive the world. And I'm really serious because the situation is not that good in certain parts of the global north. And I think that to show the commitment and the implementation and the results should also drive the world for the response. So just to finish and to say that I really also believe in the work between the countries. I think that each program has its own quality. And what I like also with PAHO is that capacity to share experiences. And I think there is a lot of value from minister level, but also from program, to put in common the challenge they face, but also the solution. And this is something that is very powerful. So I do look forward to first to see that, but also to contribute to this fight. I think it's something that we can see in our life. That's something very important, that with the work, with the commitment, with the innovation to make this affordable, we can really eliminate in our life, and we can see that and we can serve the women. So thank you, all of you. Thank you, Dr. Barbosa, ministers. Thank you, Silvana and Mauricio. We will be with you to really put the fight as a priority and make it happen. Thank you so much.
Thank you so much for those wonderful words of support, and we completely agree with what you're saying. I think we're learning from the different countries the great experiences through the support and the work with United. We were in El Salvador last week, and how that will work with Guatemala and other countries and in the Caribbean. It's wonderful. So thank you so much for making the time and expressing that support for us.
Thank you so much.
Thank you. Vamos a pasar al español de nuevo y
we will move to Spanish again. I will introduce Dr. Melissa Lopez Varon from the MD Anderson Cancer Center, an organization that has been supporting PAHO for many years. But today, she will talk to us about a very specific multi-year project that in the pandemic, with so many difficulties and uncertainty, we didn't know what would happen. And that gave rise to the ECHO project that Dr. Lopez Varon will share with us today. Thank you for all your support at all times along the process of the launch of Elimination Initiative 5 years ago. Thank you, Mauricio. Good morning to partners from the Latin American region. It's an honor and a privilege to be here with you today. Thank you very much to PAHO colleagues, Dr. Massa, Dr. Benitez, Dr. Luciani, Dr. Barbosa, and also the partners in the panel and the 800 plus individuals connected today together in the World Cervical Cancer Elimination Day. As the mother of 2 daughters, I'm very grateful to all of you for this possibility to be able to dream about a world free from cervical cancer. I would like to talk about the ECHO project that Mauricio said was born in the pandemic. What is ECHO? It's one of the knowledge exchange and exchange of relevant information to move knowledge instead of moving individuals. The ECHO project helps to constant communication, to have best practices closer to home, where we don't want that the knowledge remains only where it's generated, but we would like to disseminate it in many directions, including clinical facilities and health ministries. This is the tele-mentorship. The ECHO project is not only a model with webinars or any other video conferencing facilities. It has 4 pillars. It uses technology to leverage scarce resources. We call that amplification. We promote or share best practices based on the evidence, and we have to use cases and examples, success stories, but also barriers. And finally, we also used a database to monitor our outcomes. So based on this ECHO model, we developed in a three-part collaboration, PAHO, MD Anderson, and the National Cancer Institute of the US. In the US, we developed ECHO-ELA, which means Elimination of Cervical Cancer in Latin America. We see many of you will recognize yourselves in these photos. Thanks for being with us for so many years, right? Our objective is to be a virtual community of best practices to disseminate impactful strategies to eliminate cervical cancer in the region and increase collaboration. Participants, we have ministries of health, clinicians, doctors, nurses, academicians, academics, and also the civil society. As we said, we have already 5 years in ECOELA. We started in the middle of the pandemic in May 2020. Our sessions are in Spanish, but we also have a large group of Brazilian colleagues, so we speak Portuñol, a mixture of Portuguese and Spanish. Thank you very much to our organizing team, Dr. Massa from PAHO. We have Dr. Sandra San Miguel from NIH, and our colleague Reina Guerrero from NDA Anderson, who organizes us and helps us to promote this program in the region. And also a special recognition to our facilitator, PAHO team, that, as you can see, they are very good representatives of different areas in Latin America. And we always count on their support to plan and to disseminate, to make ECOELA a successful program. We have already conducted 40 sessions with an average of 53 participants by session, more than 500 participants registered from 27 countries in the region. Each of these points is a connection institution. We have about 200 active facilities with participation not only at a central basis, but also a regional basis in each country. There are different areas that are connecting, and this facilitates collaboration, including inside countries. Half of participants are doctors, 30% of participants work at health ministries, and 44% of participants work at clinical facilities and hospitals. We don't repeat the same curriculum in the last few years. 5 years ago, we addressed the question that why is it important to introduce the HPV vaccine in Latin America, and why is the introduction of HPV test recommended at the national level. And the last few years of ECOELA, we have moved to coverage and to the implementation of the single dose of HPV vaccine. And very importantly also, what is the civil society role in the strategy to eliminate cervical cancer? This has been fantastic. And then we have also talked about the implementation, about the self-collection of HPV at the population level, with great support. Our colleagues from Argentina are a great inspiration because they have a great experience. We surveyed many people, more than 90% said that it was very important to learn one from the others, and they also said that between sessions there had to be more communications to continue cooperating. So now we are collaborating with UICC. They have given us a space in UICC Connect. It's a collaboration network. Here we have our page at ECOELA with about 40 people that connect between sessions to talk and to announce webinars. This is one more tool to continue collaborating, including between ECOELA monthly sessions. Our collaborators helped us to establish focal top points with a very simple, specific methodology covering 5 key topics. But I want to read what one of participants in ECOELA said. I learned how different countries are addressing the elimination of cervical cancer, and this helps me to think strategically and how can I address this problem in my own country. So ECOELA is a platform that allows us to learn one from the other. To conclude, ECOELA is a complementary tool to increase the dissemination of cervical cancer elimination strategies in Latin America. It joins participants from all the region. Even within countries, participants join others inside a country from rural and urban areas. This network increases the collaboration between countries and facilitates a multi-directional learning. We all learn from each other, and this adjusted to the priorities depending on how the strategy is implemented in the region. So please scan this QR code. We want all of you to be part of our ECOELA. Our meetings take place each Friday in the month. And if you have any topics you want to stress, please let us know so that we can include this in an ECOELA meetings. Having said this, thank you very much for the invitation and for continuing moving ahead in our dream of a world free of cervical cancer. Thank you very much. Thank you very much, Doctor. I think this message resonates with what previous collaborators from UNITAID and ICID said. The importance of being able to learn one from the others is a clear message that also is disseminated through ECHO. And sometimes these virtual components are virtual meetings, but then in real life, when colleagues meet in person, they deepen their relations beyond the monthly meetings. So there are friendships and collaborations that develop over the years. Again, thank you very much for making this possible and uniting all of us through the years. To continue, we want to include an innovation topic. Innovation is important for us as region, and so we decided to invite Pedro Barbosa. He is the executive president of the molecular biology of Paraná IBMP. He will give us one of the best news of us as a region for the last years. To have a change or an impact in Brazil can also have a significant impact in the rest of the region in the elimination of this disease. He will share his experience, as our director said at the beginning, the development of an HPV biomolecular test for our region. So the floor to Dr. Pedro Barbosa. The floor is yours. We can see you, but we cannot hear you.
Olá.
Ahora sí. Yes, now we can
Hello,
hear
everybody.
you.
Olá, a todos.
Hello again, everybody. I will start talking about the word friendship that Mauricio so well referred to in his previous talk. And also like to firstly thank Mauricio for his cooperation and the friendship relationship between the IBMP and all of those that allow us to achieve the development of our test, HPV test. Also, I would like to express my gratitude for the invitation to participate in this webinar. I believe all of you can see our presentation. So again, thank you all again and express how happy we are to participate in this webinar commemorating the first day for the elimination of cervical cancer. It is important to really value the PAHO leadership with Dr. Jarbas Barbosa, a great friend, and all his team. And not only in the Americas, but also all the partners of PAHO here in Brazil. And also thank you to all ministers, health workers of all our countries, of our region, participating members of the civil society. They're here with us participating in the webinar, but just by the number we see in terms of participants, we can define how successful it's been. Also, refer to what Mr. Padilla said, our President Lula representative in the health part of, and also responsible for ensuring that control of cervical cancer in Brazil really becomes a reality in its three pillars: the vaccination, the screening, and also the treatment. IBPM, it's a biotech company. Again, I'm using the words from Mauricio to refer that DNA, IBPM, it's innovation. We work so that the development of new solutions, biotech solutions for the health sector, it is actually the reason we exist. We've been around for 15 years. We are a non-profit within our partners, Fundação Fiocruz. It's well known in the Americas and in the whole world. We are based in the state of Paraná, the city of Curitiba, the capital, and also we have the support of the state of Paraná. Since our beginning, our mission was to offer biotechnological solutions, especially in terms of diagnosis. Our main purpose is to become a reference in terms of innovation for health solutions. We are aware of the technological reliance that our countries have. Therefore, we are trying to contribute to overcome this reliance, becomes indeed a reality, offering solutions for the health, for an industrial complex of the health sector in Brazil and the Americas, especially referring programs of this magnitude that we are discussing here today, which is the control of cervical cancer. We really appreciate challenges for the innovation. We work with biotechnological solutions. Quality, it's our main guideline. But something that defines us is that we have a commitment with life. We are not only delivering tests, we want to deliver more lives, better quality of life, less deaths, less diseases. Therefore, for us, it's a great, great pleasure to be working and contributing with a program of such relevance, so that we can face a disease that was responsible for many deaths, but it is actually absolutely preventable and curable. So the work of organized screening as a pillar of some of these programs could become extremely important. Besides our presentation and our production, innovation in terms of the diagnosis, HPV test, DNA, IBMP, we have around 44 products developed and registered. We have production capacity quite relevant in the terms of diagnosis. With good practice in terms of production that is able to deliver millions and millions in tests for the health system. And we also work in a very well-developed area, able to create new products around 1,500 square meters in terms of research and development with very qualified personnel. And we are a group in the IBMP. We are more than 180 team members working as well in different areas with other companies that are partners of IBMP. We can see some photos of our production plant. We have best practice certified. We're also being certified by ISO 13485, so which allow us to provide services and products to different countries. So therefore, we're able to export. This is our test. It's a biomol HPV high-risk kit. It has a very specific feature. It has been plenally developed here in Curitiba by the IBMP. It is qualitative, means that is mainly for the detection of 14 HPV genotypes. So what is all the programs require in terms to answer for the screening strategy for the high risk genotypes defined by the WHO, implemented by PAHO, and also by all the countries that adopt that country, as we have recently heard by the ministers of the Latin American countries that already have programs showing results. This test, it has a history. And when we refer to innovation field, it's very, very important to talk about the collaboration. In 2020, when the IBMP was completely engaged in the control of COVID-19 during the pandemic, and also there we were able to show our innovation ability when we developed the first national test that was utilized in large scale in Brazil, not only the biomol, but also rapid tests. We were asked by a friend at that time that was seeing our participation trying to overcome the pandemic of COVID-19. The name is Dr. Mozart Salles. In 2020, he was in the state of Pernambuco, northeast of Brazil, and together with us, working, trying to face and overcome the pandemic. By the end of the year, he calls me and says, Pedro, IBMP would like to develop an HPV test, high-risk HPV test of national scale. I answer here the way we answer when we are asked to be part of a health compromise. This is a duty. So therefore, at this moment, we started our work in terms of developing this HPV test. And we are able to have this product registered by Anvisa in 2023. In 2024, the test was incorporated as a technological product by the health minister, and now 2025 we has been internationally validated following the necessary criteria. Now I'd also like to register the participation of our participants. The state of Pernambuco, through its health secretary, he was the main partner to define this test in Brazil, disseminate this test in Brazil, supporting and motivating for the good program in Brazil that we were able to have, and we are able to have it, to have a national test with other partners that are therefore registered, as you can see on our screen, Tropical Institute, LICA from the University of Pernambuco, with the help and support and the articulation from PAHOs, not only in Brazil, but as well through Washington, D.C., where Mauricio was essential for that process for us. And now in 2025, since we obtain our international validation certification, again, I need to refer the role that PAHO exercise trying to promote our international articulation with European partners so that we will be able nowadays in the first semester, beginning of the first semester of 2025, our international validation, which is a sine qua non condition so that our tests can ensure a quality so that the screening process in Brazil should be adopted with a specificity pattern that shows actually the quality of our HPV test in terms to be comparable to other tests all over the world, and which we are very proud to say that we were able to achieve that pattern with the competency installed in IBP in terms of research and development, but also establishing this a very good relationship with our partners. IBMP, we are here willing to assist our brother countries in the Americas to save women, to eliminate cervical cancer. Reiterating again, one of our main values, one of our mission, we are our compromise with life, and therefore with the life of women in all our development and production structure, it is at service for women, not only in Brazil, but also with our countries, friend countries in Latin America. Our delivery capacity and production capacity is quite high, so much so that we were able to assume all our commitments with the Ministry of Health of Brazil, and again, reiterating the assistance of the Ministry of Health with its national product that could be utilized not only in our country, according to the forms of Mr. Padilha said that you're already using, and we are following each state, each city, providing our tests align with the leadership of Minister of Health of Brazil, Mr. Padilha, and Secretary Mosai. Concluding, I would like also to reaffirm, reiterating the word that Mauricio presented us all: friendship, integration, support amongst our friends, our countries in the Americas, but also say that besides all the HPV, high-risk HPV tests available for this program, IBMP, we have other products, totally national, developed in our plants with capacity availability in terms of dengue, chikungunya, dengue, for diagnosis of respiratory diseases such as other diagnoses. IBMP is at your disposal for any programs that values life, that will turn public health of our countries. It is at the same level of the needs of our societies. We are very proud to be part of this program. Thank you so much.
Obrigado, Pedro. Muchísimas gracias por tu liderazgo, por tus palabras, a ti, a tu equipo, que lo que siempre desean tener es la mejor prueba que puede ser. Y nosotros aquí estamos para apoyar que lleguen a sus metas nada más, y ser una pequeña parte del gran esfuerzo que ustedes han realizado. Es un honor para nosotros como organización. Muchísimas gracias, Pedro, por estar con nosotros el día de hoy.
Thank you, Pedro, for being with us today. It is always a pleasure to work with you. Now, I'm going to give the floor to Silvana, but before doing that, I want to say that when I began to work on this some years ago, I never thought that we would see an international day for cervical cancer elimination. I never thought that would be possible, but now it is. And I wanted to thank Silvana for more than 15 years now. This organization has kept all of the region together, not only having regional meetings, but also with an action plan, something that we can follow as a region. So, Silvana, I wanted to thank you for your constant leadership, and I'm going to give you the floor now so that we can wrap up our meeting. Thank you, Mauricio, and yes, it is very satisfying. It's motivating to see all of this commitment, this new test coming out of Brazil. And I am sure that we will be the first region in the world to eliminate cervical cancer. And I saw in the chat that perhaps this would be also a good time to recognize Nubia Munoz, the researcher that discovered that HPV is the principal cause of cervical cancer. And she's from the region. She's a great researcher and a great leader, and she is behind all of these efforts. So I wanted to thank all of our partners that were part of this panel. I wanted to thank ACID, Unitaid, and the Anderson Cancer Center. We have other people we're working with that were not able to join us today, but I do want to thank the University of Miami. They are the collaborating Center for Cervical Cancer, Florida International University, Saban Institute, Gaben, and the Caribbean Coalition. So we have a lot of partners who work with us, and we will continue to work tirelessly to eliminate cervical cancer in the region.
We hate to end because there's so much enthusiasm and information to share. But to give some closing remarks, I'd like to invite our director of the Department of Non-Communicable Diseases and Mental Health, Dr. Anselm Hennis, to close us off. So thank you, Dr. Hennis, over to you.
Thank you so much, Silvana. Thanks to all. This really was quite an exciting webinar. And as we saw, we had over 800 people tuning in at various times. So really, as we conclude today's webinar, I'd like to thank each and every one of you for joining us in our commemoration of the first official World Cervical Cancer Elimination Day. Your presence and commitment reaffirms our shared determination to eliminate cervical cancer as a public health problem. And as we discussed during the course of this event, the region of the Americas could well be the first region in the world to achieve this. Let's make that our target, and let's work to achieve this united, and I'm sure we can do this. I would like to thank the ministers who took part. Minister Aguilera of Chile, Minister Malvin Joseph of Antigua and Barbuda, Minister Padilla of Brazil, and Vice Minister Alvarenga of El Salvador. So thank you for your leadership and putting your country on the path to elimination. Antigua and Barbuda has demonstrated the feasibility of moving away from cytology and scaling up HPV testing in a national screening program. Brazil is innovating with the development of the first ever HPV test manufactured in the region and setting an ambitious plan to expand HPV tests to the national level. And we heard they're going to do that next year. El Salvador, through its pioneering screen and treat approach with HPV tests and thermal ablation, is already observing reductions in cervical cancer. And Chile has adopted a non-valent HPV vaccine through the PAHO Strategic Fund, expanding the protection of girls and boys against HPV infection. So let us learn from these practical experiences, and let us be inspired to implement similar strategies that can ensure high coverage of HPV vaccination, screening of HPV tests, and treatment of precancerous lesions with thermal ablation. To our highly valuable partners at ICEED, Unitaid, MD Anderson, and IBMP, your significant contributions, innovations, and support for this region to progress towards cervical cancer elimination is really highly appreciated. ICEED is instrumental in mobilizing resources and political commitment for cervical cancer elimination. And we say our significant and sincere thanks to you. Unitaid is providing critical support to expand access to HPV testing and thermal ablation. MD Anderson Cancer Center is building clinical excellence and capacity through training and technical support in cancer treatment. and IBMP is creating more options for HPV tests through its innovative local manufacturing. And I'm sure it's going to have a major impact in the region of the Americas. So together, your contributions are transforming the landscape of cervical cancer prevention, not only in individual countries, but across Latin America and the Caribbean. We thank you for your partnership, your vision, your leadership, and your commitment to saving lives. As we reflect on the experience and best practices presented in today's webinar, let us be reminded that cervical cancer is indeed a devastating disease, but it also has potential to be the first cancer to be eliminated. Let us continue to work hand in hand, implementing new strategies to reach and sustain the 90-70-90 targets by 2030, and cultivating new partnerships to ensure that no woman in the Americas dies from a disease that we have the tools to prevent. Once again, let me thank you for your dedication and for being part of this historic moment. Let us keep the momentum going. Together, we will eliminate cervical cancer in the region of the Americas. Thank you so much.
Wonderful. Thank you. Thank you very much to all our speakers, participants, and a special thanks to our organizers, Mauricio Massa, Sarah Benitez, Arancha Cayón, Mechi Migliori, Sonia Ortiz, and all those involved in this webinar. Feliz Día de Eliminación y que tengan un buen día. Gracias por acompañarnos. Ciao.
Happy Elimination Day, and thank you for joining us. Goodbye.